Good afternoon, Dr. Kolhe. It's a pleasure to have you here with us for a few minutes so we can get some insights from you about your journey, about how you have worked in the oncology field with your patients, and also the future of oncology. And also, thank you for attending our polls conference for the 1Cell.Ai, which is the first of its kind, and we hope to have many more. So first, welcome. And first question that I would like to ask you is that if you could share a little bit about where your affiliation, which institute you work at, and also a little bit about your medical journey, like when you did your MD, and how you had your medical journey.
Sure. Thank you for inviting me here. I think it's an honor to be with here with such a successful and very high impact, high yield conference. I am a professor and chair of pathology at Medical College, Georgia, Augusta, Georgia. I've been there for the last 19 years in different capacity. I'm a molecular pathologist by training. I do mostly oncology and non-oncology, this molecular testing for our patients at the Georgia Cancer Center. I started my journey not too far away from here in Aurangabad, India. I did my medicine there. I went to US. I did my PhD, did my graduate school, and that's when I realized what subspecialty I wanted to do. So pathology was such a amazing continuation of what I was doing in my PhD, and it really helped me understand and take a step back and be more thoughtful about how we can help our clinical colleagues. After pathology, molecular pathology was something I was interested in, and that passion continued. And it was that time when molecular pathology was just coming up, and I'm glad I went there. And now molecular pathology is pretty much everywhere. Each and every subspecialty, clinical subspecialty, there is a molecular test, molecular variants which add pretty significant value to patient care, patient outcomes. And now molecular pathology is pretty much the center of most, if not all, the clinical testing we do.
That's awesome to hear. Obviously, the journey has been very fruitful, and it was the right decision that you took. So is there, I know you've worked on so many cases and with so many patients, but is there one patient or some example of where you used a classical methodology or the, let's say, time tested original methodology of how to treat or you treated a cancer patient?
There are multiple examples, but one of the example I love to give all the time is we had a 24-year-old patient who had a aggressive mixed lineage leukemia. So leukemia is a blood cancer type which can have either myeloid or lymphoid, but this patient had a mixed lineage leukemia. And as tradition goes, the patient was treated with chemotherapy. The patient had relapse, and then they had a transplant, bone marrow transplant done. After that, he also relapsed. Again, chemotherapy was done. Again, relapsed. At some point in his journey of treatment, the leukemia became so aggressive that there was transformation from leukemia to sarcoma. We call it myeloid sarcoma. And that's where my oncologist friend took biopsy and asked me, "There's something we can do for it." And that was the beginning of comprehensive genomic testing.
Mhm.
So we at that time, maybe 10 years ago, we just had moved from single gene testing to bigger panel. And we tested that patient's sample on that particular panel. And because the tumor has transformed from leukemia to sarcoma, the comprehensive genomic testing on that particular sarcoma is totally different from what leukemia would be. But the traditional, they would just keep on treating with leukemia, like, because the origin was leukemia. But this new information really helped them to identify new drugs, which were very targeted against that particular sarcoma. And it really helped them to change the outcome of this patient.
And that's awesome to hear. And you literally segued into my next question or my last question, which has to do with there are so many companies developing different types of technologies, right? Because cancer is one of the diseases that still mankind hasn't conquered compared to so many other diseases. So, what do you feel is, from a technological perspective, advancement perspective, either OneCell's.ai's technology or any other company's technology, how do you feel that's going to change what you do in your daily practice with your patients? And what do you think how the impact will be in order to make treatment decisions?
I think we have come to a point where it's more than just technology. I think the approach to what we do in the testing has to change. All these years, we are looking at one-dimensional genomics, just at the DNA level or RNA level. I think the next revolution is going to be multiomics, where we're looking at epigenetics, DNA, RNA, protein, uh, and then looking at a combination of all those things and use of AI and see how does that benefit to the patient at that particular given time, and then longitudinally monitor and see uh, how it evolves based on the treatment. So I think multiomics plus AI, longitudinally monitoring the patient, is just probably going to be the next wave of revolution, not only oncology, but overall clinical sciences.
That's really nice to hear. I mean, of course, we have multiomics and longitudinal monitoring, and we don't know of many other companies who may come up to the forefront, but definitely very encouraging and for leading oncologists like you, especially in the US, to be able to kind of lead the charge and be able to influence be an advocate, influencer for other oncologists too would be awesome. So thank you so much for your time.
Thank you.
Really appreciate it, Dr. Kolhe, and we look forward to working with you.
Thank you.
Thank you. Take care.